The final topic in the tissues chapter is about membranes. Now, membranes are where multiple tissues come together. As we move through the levels of organization between molecules or chemical level and cellular level, we have molecules, macromolecules, organelles. Between tissues and organs, we have membranes, which is more than a tissue but less than an organ. In saying that tissues come together to make something more, that can actually fall into two categories. There are epithelial membranes, which is an epithelium and associated connective tissue, which is mostly areolar or connective tissue. And there are the non-epithelial membranes, which there's only one type, which we'll be talking about, and it's really connective tissues that come together to make up a structure, and that's specifically at the joint. This gives an example of where the four types of membranes that we want to consider are located. First, there are mucous membranes, which line the digestive, respiratory, urinary, and reproductive tracts and secrete a substance called mucus. There's the serous membranes, which line the lungs, the heart, and the lower digestive organs in the abdominal cavity, and line the cavities that those organs are found in. And then there's cutaneous membrane, which is really just the skin. There's only one cutaneous membrane. And then finally there are synovial membranes, which are the joint capsules, basically, and the lining therein that makes a fluid which helps to lubricate the joints. The three epithelial membranes shown here we'll look at using pictures from the textbook. So there are some labeling in the textbook pictures that don't have to do with the membranes precisely because they're taken out of the chapters where those structures are actually discussed in full. First, we have the mucous membrane. The example here is the respiratory mucosa. Specifically, this one is lining the trachea. It's made up of an epithelium, which in the case of the respiratory tract is a pseudostratified epithelium. And that epithelium has a basement membrane, and then there's associated connective tissue called a lamina propria, which is areolar connective tissue and contains blood vessels and supporting structures for that epithelium. The epithelium contains specialized cells called goblet cells, which are making the mucus components that are secreted out onto its lining. Now, we see mucous membranes in the digestive, respiratory, urinary, and reproductive tracts, and so there's a variety of different epithelia that are associated with it. Here we see pseudostratified, like in the respiratory system. In the digestive system, we can have a stratified squamous epithelium or a simple cuboidal epithelium. In the urinary system, we can have a transitional epithelium. The possible epithelia associated with mucous membranes is rather varied because of all the different locations where they're found and the different functions that they need to ascribe to besides just producing mucus. On the other hand, serous membranes are fairly standardized. Here we see the serous membrane that lines the lungs, called the pleura. All serous membranes have two layers, which are exactly the same, just facing each other. There's the visceral layer, which is lining the outside of the particular organ, and the parietal layer, which is lining the inside of the cavity where that organ is found. Both layers are made up of a simple squamous epithelium and its associated connective tissue, again, an areolar connective tissue. And they're facing each other with a space in between called the serous cavity. The apical surface of either simple squamous epithelium is lining into that pleural cavity. And the membrane will secrete a watery fluid called the serous fluid, and that acts as a lubricant often for how those organs interact with the surrounding tissues. As the lungs expand during breathing, or the heart moves with pumping, or the digestive organs move relative to each other during digestion, there needs to be a little bit of lubrication in there. That's what that fluid's for. But in all those cases, there's a specific structure that we see, a simple squamous epithelium and its associated areolar connective tissue. And here we have the cutaneous membrane. Now there really is just one cutaneous membrane, and that's the skin. And the structure of the skin is a little bit more complex than the other membranes. It has a particular epithelium, which is the stratified squamous epithelium. And then the associated connective tissue, which is referred to as the dermis, is mostly dense irregular connective tissue, although there's an areolar connective tissue immediately adjacent to the basal edge of the stratified squamous epithelium. And that dermis has a number of structures embedded in it that play a lot of roles in the functioning of the skin. Now, there are a lot of labels in this picture because this is the picture from the integumentary system chapter, so there's a lot going on. But as far as a membrane is concerned, it's really just in the brackets that we see off to the side. The epidermis is the epithelial layer, again stratified squamous epithelium, and the dermis is the connective tissue layer, which is mostly dense irregular connective tissue, but there is a little bit of areolar connective tissue adjacent to the epidermis. This brings us to the one non-epithelial membrane that we want to look at, and that's the synovial membrane. It's part of the joint capsule that we see at every synovial joint. There's dense regular connective tissue or dense irregular connective tissue that's part of what's connecting the two bones together. Depends on the exact type of connection. There's hyaline cartilage that's lining the edges of the two bones where they come together at the joints. And then there's a lining along the inside of the joint cavity, which is connective tissue, although some sources will try to say that it's an epithelium. The cells that are there that are secreting the synovial fluid are actually a variation of fibroblasts or a similar type of cell. So they're part of a connective tissue. They're not really an epithelium. So it's really just connective tissue that makes up the synovial membrane. And again, it secretes a fluid called the synovial fluid, which will fill that joint cavity and provide some lubrication for where the two bones are going to move relative to each other in the joint. In a picture like this, that synovial cavity is often pictured as a fairly large space, but in actuality it's going to be pretty small as the fluid really seeps into the surrounding tissues and gives them all kind of a soft, pillowy texture. If a synovial joint was filled with this much fluid, it would be arthritic, which is an accumulation of that synovial fluid in the capsule and can be painful as it puts pressure on the surrounding tissues. Though it's not specifically about membranes, I also want to include at this point a brief discussion of how tissues repair themselves. Now, the picture we're looking at here is suggesting a cut through the skin, which everybody's probably familiar with. That's going to cause bleeding if it's a deep enough wound to get to where the blood vessels are in the dermis. And the blood will fill in the wound site, forming a scab. The scab's going to be protective while it allows the tissues underneath it to heal. And we're talking about here basically epithelial and connective tissues and how they repair. Now, epithelial tissues are always turning over and making new cells to replace old ones that have been damaged or destroyed. So when you have a wound like this, the epithelium will really just kind of grow back to the way it was before, starting at the basal layer of the cells. Remember, the epidermis is a stratified squamous epithelium, so the basal layer is where the cell growth originates. those cells will grow across the wound area and connect the two sides of the damaged epidermis, and then those cells will divide and grow in and fill in that space. And the epidermis will really be back to good as new. The underlying connective tissue, however, will be a little bit different. What happens there is fibroblasts migrate in to regrow the tissue, but because there was an insult to the tissue, injury, they're going to try to grow back a little bit stronger. So they'll lay down more collagen fibers to possibly be able to withstand the same kind of injury. And that fibrous tissue, which can also be referred to as granulation, will become what we call the scar that's visible through the epidermis. Now, the scar isn't in the epidermal layer, it's in the dermal layer, but we can see it as that fibrous area underlying the epithelium. We see the same sorts of tissue repair taking place in other situations. If this were a bone, we'd have another fibrous area as collagen grows in to strengthen the broken bone area, and epithelial tissues, especially in the blood vessels, would grow back good as new. What's different is muscle tissue and nervous tissue. Muscle tissue will tend to grow back trying to be a little bit stronger, trying to do more work than it was capable of when it was damaged. This is really the basis of going to the gym and working out. You push your muscles a little too far and they grow back to be a little bit stronger. Now, if there's a serious injury to muscle tissue, it won't grow back as easily, but normal everyday wear and tear on muscle tissue will grow back, and it'll actually grow back a little bit stronger. Nervous tissue is a little bit weird. In the central nervous system, regrowth of tissue is basically suppressed, and then in the peripheral nervous tissue, it's aided by the glia and supporting tissues around the damaged nervous tissue. We'll talk about that a bit more when we get to the nervous system later in the semester. Consider this question. When you feel that you've reached an answer, hit the next button to go into the next slide, which will reveal the correct answer. Serous membrane is made up of a simple squamous epithelium and its associated areolar connective tissue. Cutaneous membrane is always made up of stratified squamous epithelium and its associated connective tissue, which is mostly dense irregular connective tissue, though there is some areolar connective tissue. Mucous membranes are made up of various types of epithelium, depending on where we're looking specifically, and the associated areolar connective tissue, called the lamina propria. And then synovial membrane has no epithelium associated with it. It's strictly connective tissue.